The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
You know, menopause is a natural part of aging, but many women struggle with hot flashes, night sweats, brain fog, and a myriad of other symptoms that can impact daily living. Here to share how a new study could change how doctors treat these issues, we welcome from Providence Gynecology Regional Medical Director, Dr. Liberato Mukul. Good to have you with us, Doctor.
Thanks, Helen.
Yeah, you bet. So, you know, for many years, women and their doctors they've avoided the hormone replacement therapy that treats menopausal symptoms. What has been the worry all these years about that?
Yeah, you know, about 22 years ago, the Women's Health Initiative study followed thousands of women who were taking hormone replacement therapy. And when that study came out, it was actually stopped because the authors found that there was a higher risk of breast cancer and stroke in women taking hormone replacement therapy. And so that led to many patients stopping a hormone replacement therapy. Many providers became very hesitant to prescribe or endorse hormone replacement therapy. But over the years, we found that, you know, many researchers have looked back at that Women's Health Initiative study and found many flaws. And, you know, for one, that study took into consideration more women that were over 60 years old. So, which means that more women were already in menopause several years prior to starting the HRT, which confers a whole different risk. In addition, you know, there was different types of hormones, different routes, and different doses that were used in those studies that are currently available today.
So a new study then debunks a lot of that data. So tell us more about that, and then how that new information is changing treatments for menopausal women.
Yeah, so the new study was published May 1st in the Journal of the American Medical Association, and this study was a long-term follow-up to that original Women's Health Initiative study that actually found benefit for many younger postmenopausal women, meaning women who were under 60 years old had significant benefit of taking HRT with a very low risk compared to that original study. So this, you know, this just adds to what we've continually been finding after that original study, that HRT does have some benefit. And women should not be afraid to come in and discuss that with their providers if they feel like that is an option for some of their symptoms.
This is huge news, I feel, among my friends. So let's talk about how is this information, what are some of the most common problems that you're seeing women experience, your patients experience?
Yeah, you know, the most common problems, you mentioned a few at the onset, you know, hot flashes, night sweats, fatigue, sleep disturbances, mood swings, brain fog. A lot of times patients will very commonly tell me that, you know, it's hard to find words when they're, you know, completing their sentences. So there's a variety of things that come, you know, that change, you know, in menopause. And a lot of times those aren't, you know, taken seriously, but it is very, very debilitating for women and affects, you know, women significantly. Some women don't have all those symptoms. They could be very minimal, but others, you know, it could be life-changing. And so we really, you know, endorse patients coming in and talking with us about those symptoms to see if we can find something that helps them. And typically it's hormone replacement. And, you know, this study just helps us kind of get that information. It helps providers feel a little bit more comfortable in terms of prescribing that as an option.
Do we still need to worry about side effects with HRT?
Yeah, you know, every individual is different, right? And so we always need to do a risk assessment. So, you know, taking in consideration your cardiovascular risk profile, you know, if you have heart disease or family history of heart disease, breast cancer, family history of breast cancer, those are all very, very important to take into consideration to decide whether or not HRT is a good option for you as a patient.
And are there any groups that should stay away from HRT?
So most the biggest groups that usually we recommend staying away from HRT are personal history of an estrogen-dependent cancer, like the most common would be breast cancer.
Yeah.
Any history of a blood clot or a stroke or a heart attack, really it's very, very difficult. There are some options for our breast cancer patients. They're usually not in the form of a systemic, medication, but those are the big groups that we really kind of just need to kind of reassess whether or not HRT is an option for them.
Yeah, Doctor, valuable information here. We want to tell everyone, if you'd like to find out more, all you have to do is contact Providence Women's Health Menopause experts. We'll put the information on our website at k2.com/Family Matters. Doctor, thank you so much.
Thank you.